We have Dr. Sameer in the studios of 106.2 Big FM. Dr. Sameer, who's an orthodontist at Clover Medical Centre, is right here in the studio of Big FM. और हम यहाँ पे बात कर रहे थे on the big boys. Well, I didn't ask you about your family, Dr. Sameer. Can you tell us, you're with your wife, आपकी partner भी है at the medical center, I heard?
Yeah, she's the majority partner in my medical center.
Majority partner?
By 1%.
That's definitely for the media right now.
Her name is Mehnaz.
Mehnaz?
Yeah.
Or she also dentist?
No, she's an interior designer.
She's what?
Interior designer.
Interior designer. So you do interior designing of smiles and then she does interior designing of the store.
That's beautifully put.
Yeah. All right, doctor. So we were talking about braces and how comfortable it is for people. I think braces have evolved in so many years. We spoke about the types of braces that we find because these are certain things that people are aesthetically bothered when it comes to good smile. I think that's something that catches your attention.
Yeah, absolutely. Everybody wants a great smile and they don't want the braces. The braces they do have a social impact and adults are very resistant to braces. So we have had to work around these things.
We were actually talking about Invisalign a while ago. So can we talk about that? Can you tell us more about what Invisalign is and do you do Invisalign also?
Yeah, we are certified Invisalign providers. Invisalign provided the best modicum for the adults, those who wanted that smile yet didn't want the straight track.
Sure.
So Invisalign is a whole series of plastic trays which have a predictive platform. They kind of decide how the teeth move and the patient just keeps on wearing these plastic trays.
It sort of flexes is what you're saying?
Yes,
okay.
Very precisely, and it kind of moves the teeth to where we want them to move.
Right.
And it gives a latitude to the patient to remove it as and when if they have an important meeting or something. Yes, feel free. Take
Amazing. So you were saying that if you need a great smile, if you need to put braces, you have to put braces. Lekin agar someone who is not comfortable with it, what would you recommend?
An Invisalign can provide almost 90% if not 100% of the movements of traditional braces. So you have a choice, either braces or Invisalign.
Okay, and normally how long does it take?
That's purely dependent on what the case is, but fair ballpark figure for almost any braces patient is about 18 months to 24 months.
All right, and have you had any chances of failures or anything?
Almost negligible. It's impossible to actually fail.
Wow. Well, in the studios of 106.2 Big FM, we have orthodontist Dr. Sameer, who is from Clover Medical Centre in the studio. We're talking about all of this in the special segment, which is the Big Boys, where we feature people who have a message of hope. वापस आके बात करते हैं about how you've been dealing with the whole pandemic COVID-19 situation, and apart from that, how has Clover Medical Centre been dealing with the whole thing, and a message of hope as well. We'll come back and talk about it. I have this dental phobia. I used to. इतना ज़्यादा नहीं है. So how do you make someone feel comfortable?
There are a lot of ways we handle gagging, and we have a lot of people who actually gag. Very often, a person who's lying down tends to gag a lot more. So we like to do the procedure in an upright position, which has been very successful.
For people like me, I used to find it very, very uncomfortable to do that. And I used to always feel like, क्या करवा रहे मेरे से? मुझे नहीं खोलना, इतने देर के लिए. And I used to feel all of that. So I'm giving you a little torture. Before you came on the show, I'm like, हाँ, इतना पास आओ mic के. So this is like payback situation right now.
Thanks a lot. We deserve it.
Well, right now, Dr. Sameer in the studios of 106.2 Big FM. He is a dentist and I have so much to ask you, Doctor. First of all, thank you so much for finding some time.
It's our pleasure.
Coming here and being a part of this segment, which is called The Big Voice. बचपन से लेके आज तक, when it comes to going to the dentist, we've always been very hesitant. I think Indians कम dentist visit करते हैं.
Yes.
Don't you feel that?
Yes, there's always a phobia.
There's always a phobia. Why do you think that phobia is it?
It was probably because of the dentistry being practiced in the 60s and the 70s. Probably even up to the 80s, Dentistry is much more refined today and much more classy.
Right.
The objective is to keep the patient comfortable during the procedure and have shorter procedures.
Dr. Sameer, please tell us about yourself and why did you choose dentistry?
Well, I'm technically from Bombay and fortunately or unfortunately, my father before me was a dentist. Actually, he was an orthodontist and so am I.
Oh.
And he was India's first orthodontist. So by default, I didn't get much of a choice.
Right.
I had to become an orthodontist.
Oh, it wasn't by choice.
Not at all.
And then how do you enjoy it now?
Oh, I think he did understand that I was totally immature and he had to decide for me and I thank him for that.
So, Doc, what is the correct age for braces, if I had to ask you? Because a lot of people think that bachpan mein dalna is a better choice.
Yeah, that's a fabulous question, and it has got two parts. I'll answer the second part first. Bachpan mein dalna is a better choice. A large portion of our practice today are adults, people who have been highly conscious and their parents didn't afford it for them at that point of time.
Right.
The main question is, what is an ideal time? There's been a bit of a dichotomy on this because some people feel a large portion that let all the teeth come and then meet the orthodontist. Whereas when you go down to the US or the Western world, they want growing children. And now the rule of thumb is at the age of 8, the general dentist should refer to the orthodontist for a primary opinion. Not necessarily that they will start treatment, but just an opinion.
Right. And people always feel that, oh, braces dalne ke baad, you can't have a lot of food, and there's something that is I think things have evolved now. There are different kinds of braces now.
Yeah, you're absolutely right. The braces have become much better. The bonding methods have become much firmer.
बचपन में तो हमारे 90s में तो ऐसा नहीं होता था ना, ये नहीं खा सकते, वो नहीं खा सकते. I am a die-hard fan of porota, yaar. I can't do without Kerala porota, and that's exactly why I didn't have braces, even though मेरे दांत थोड़े बाहर रह गए.
Kerala parota to खा सकते हैं, but let's say I've been working from 97. There was a big list of things we would give the child.
Yeah.
Today, we are much more relaxed because we just explain to the child that nothing hard or sticky. Most of them kind of conform to it.
Right.
Their parents are paying money and they want a result, and we want it beautiful.
So quickly, can you tell us what are the kinds of braces available in the market now?
The kinds of braces is what's giving us the multiple choice question today.
Yeah.
Previously, we were just restricted to the common train tracks or the metal braces, which were not very well perceived socially. Today we have even cosmetic braces, something from the aesthetic perspective, or ceramic braces put from behind the teeth, or lingual braces, invisalign or aligner technology where we just use trays and it can't be seen. So we have evolved and we are now catering to the adults.
Great. Now, since we took that word invisalign, we're going to be coming back and talking about that. And there's this thing, bachpan mein hum hamesha bolte the, the people who wear braces go like, oh my God. They talk like that. Is that right?
I don't know why they actually did that. Yes, I know what you mean. I had a cousin sister who actually used to do that.
Yeah.
But basically, if the braces are placed from behind the teeth or inside lingually, your speech is slurred.
Oh.
Whereas when they're put from outside, there should be no speech slurring at all.
All right. So in that slurred speech, I'm going to say we're going to come back to the show in just some time. Thank you so much, Dr. Sameer. Just stay out here and stay tuned to 106.2 Big FM. I've heard about pre-ortho and post-ortho. Can you tell us more about it? What is that? What are these treatments?
Yeah, these are very high-flying terms, but basically what they mean is that before we start orthodontic treatment, we need to have certain parameters in place. We need to have certain data. That means we take some x-rays, some photographs, some measurements, and ensure that the teeth are clean, the fluoridation is done, and there are no cavities. That is pre-ortho. Post-ortho means we have got a great result. We have removed the braces. We want to ensure the teeth remain in those positions. Therefore, post-ortho would require the retainers. Retainers are something which prevent this movement and maintain that fabulous smile.
Oh, that's pre and post. And many of my friends who visited Clover Medical Centre, they've said that it's absolutely clean. Safety measures have been taken care of. The protocols have been taken care of. Can you also give us a brief on how you've been handling the clinic and safety measures?
COVID itself was a wake-up point for us.
Sure.
We luckily had a lot of steps instituted well before the advent of COVID. Luckily for us, the department or the Dubai Health Authority has been a fair partner, giving us a lot of guidance.
Yeah.
And it's very easy to just follow these guidances.
Right.
So they are for the safety for the patient and for us. So we have tried to maintain social distancing, spaces between the patients as in terms of time and how they sit in the clinic.
Right.
We actually encourage the patients to reach the clinic, call us, and we will tell them when to come up to the clinic so there's no crowding.
Right.
It's actually very easy to do and very doable, and people should do it.
Doctor, I'm sure you have a very, great connection with people with great smiles and teeth, because that's your department. Lekin mera connection hai food ke saath. So I always say that I judge by the way you order food, And वैसे, do you judge by the way people smile and looking at the teeth?
I've always had that conversation with my wife. She keeps on telling me, why are you staring at that person? So I say, you see a smile, I see opportunity.
Ooh, that was a slight burn, kahin. Okay, do you want to burn me on the show? It's okay, you can roast me.
You have been a good RG on this.
Really? Yeah. Okay, what do you think of my smile?
Okay, let's have a look at it.
Okay,
no opportunity out here.
Really?
It's fabulous.
No, I have cavity, doctor, which I'm obviously, वो तो दिखाई नहीं देगा आपको.
You said smile, not cavity.
In the studios of 106.2 Big FM on the Big Voice is Dr. Sameer. जाने से पहले a message of hope for all our listeners listening to the Big Morning Show.
Okay, we are living in one of the finest countries which has exceeded our expectations during COVID.
Yeah.
So let's hope for the best and we are going to come out of it soon.
And वैसे ही आप भी smile से spread करते रहिए, literally making a beautiful smile for everybody. Thank you so much for being a part of the show and वापस आइएगा.
Thank you, Pavitra.
Thank
Great
you so
time.
much, Doctor.